Like so many other Americans, we lost my son, Bo, to cancer. During Bo's fight with glioblastoma, a deadly form of brain cancer, we learned so much about the incredible breakthroughs that are just over the horizon in cancer treatment, and those that are right in front of us. But I also learned that cancer research and the care system are not set up in a way to deliver the best possible experience and outcomes to every patient. For example, I'd like to be able to tell you all that affordability of cancer treatment is getting better, not worse, but I can't. Even if treatment is fairly priced, hundreds of thousands of people here in the United States still cannot afford the treatment. Look, folks, no one should lose their home because they have cancer. And no one should be cutting the number of pills in half that they have to take in order to save money, risking their health. No one should be skipping treatments for months when it's their single best hope for survival and recovery. But for so many cancer patients, these are the choices they're making as I speak. How can we say as a nation, you know, there's a treatment drug out there that could save your lives, but we're sorry, you can't afford it. The cost isn't the only impediment we face. Coordination of research and care across docs and hospitals also needs to be improved. They're wonderful people, but they need help. For example, I'd like to say that a cancer diagnosis in St. Louis is understandable by another doctor in Minneapolis. In the case of a patient who moves to seek a second opinion, but I can't. I'd like to be able to say that the doctor in Bemidji, Minnesota has all the tools needed to treat whichever cancer may have been discovered, just as the doctor at Dana-Farber or Sloan Kettering or MD Anderson, but I can't. Folks, I've spoken to an awful lot of physicians across this country, and I've heard them say that because of the lack of uniform standards, they wouldn't trust a pathology report from another doc in their own institution, much less one from another state. I'd like to say that the government is moving quickly to modernize our approach to funding research, but I can't. In each of these problem areas, there are reasons grounded in tradition and culture and history and in personal advancement that may have been valid, but certainly are not any longer. And they are strongly resistant to change. Like nearly every American who has lost a loved one to this terrible disease, the fight to end cancer as we know it is personal to me. How many of you have gone to your oncologist for your loved one or for you and saying, Doc, can you give me another 10 days? Can you give me another month? I want to see her married. Every day, every minute matters to patients and the loved ones. So we must bring the same sense of urgency to changing the system now, the urgency of now. As I've traveled the country and talked to people fighting tirelessly against this disease, I find myself hopeful. Things are beginning to change. For I see the day where prevention is more effective, where we reach all communities with early detection, so that treatable cancers are found before it's too late. I see the day when you can take your child or grandchild to their school physical and they'll be vaccinated against certain cancers, just as you can now be vaccinated against HPV and the 5 or so cancers it causes. I see the day when we'll be able to identify through markers in the blood cancers that haven't even yet developed. I see the day when care is personalized and more effective with less harmful side effects. And we treat each patient with the right therapy the first time when it's most likely to be effective. These possibilities give us hope. It gives me hope. I saw it through Bo's fight. So since leaving office, my wife Jill and I have launched the Biden Cancer Initiative to continue this work and give millions of families struggling with this diagnosis hope. If we can change the culture around cancer research and improve our system of care, we're on the cusp of remarkable breakthroughs and have a chance to give patients and their families real, tangible hope. This is all within our grasp, but we have to grasp it now.